Okay, I'm restarting because now what I'm going to do is I'm going to kind of turn a little bit here. I'm going to show you palmar kneading. And once again, I could do, or knuckle kneading is what I want to show you. Knuckle kneading. I could have done knuckle kneading on her back, and literally that is me using my knuckles, okay, and digging in. But I want to show you on the plantar surface of the foot here, okay. So, just a little lotion. I'm not going to take a lot of lotion for this, okay? So what I'm going to do is I'm going to come on this side so that you guys, I'm moving the table just a little case. Okay, so I'm going to show you on this foot since it's closer to you, okay? So what I would do is I would come in and just do some kneading, okay? I might even go, relax, up the leg here a little bit, okay? Really prime it, get the lotion all over there, okay? Make sure that if there's any swelling, I may go ahead and do effleurage, okay? So I might do a couple minutes of effleurage here where I'm waiting, and you'll see I'm pausing, okay? So I stroked, little effleurage, and then I noticed, wow, she's got a lot of these little knots and stuff in her foot here. So what I'm gonna do here is I'm gonna take my knuckles and I'm gonna go in and I can just knead the surface of her foot here. This is great for plantar fasciitis. It's great for just anybody who's got sore feet, okay? If someone's really complaining of foot pain, you can get in there. It's kind of similar to the deep circular friction, except for I'm not really staying in one place, okay? I get my knuckles in and I kind of twist, okay? It's a form of petrissage kneading, okay? And it actually does feel pretty good. You feeling okay?
Yeah.
Okay. So I just asked her if it felt okay. All right. And then usually I don't do this with them on a stretch, but if you're in a situation where, you know, you want to have them up in the air and get a little stretch on there if the patient can tolerate it. And then I'm probably going to go in and after I do that, do a manual stretch, soleus, plantar flexors, and or have the patient do their own stretch. But it really is digging with those knuckles, okay? So that's knuckle kneading, okay? All right. What I'm going to do now is I'm going to have Casey flip over. I'm going to have you turn away from me and get yourself situated there. You lay on the pillow. Here, okay, there you go. All right, pillow under your knees. We'll take this one out. Is that comfortable? Mm-hmm. Okay, cover your legs back up. Okay, so remember I said that I was going to show you some cross friction technique as well. Okay, so I'm going to show you on her arm here. You'll have to remember this one from orthopedics, right? We did this one, except for I don't use lotion unless it's in the middle of another sequence, but then I'm gonna try to rub the lotion off. Once again, I'm going to take my 3 fingers here, okay? I can have her put that finger up and then hold it up there. Don't let me push it down. Don't let me push it down. There we go. Little trick, I can see the tendon popping out right there, okay? I'm gonna have her relax. Okay, I could have this elevated on a pillow for the sake of the video. I'm going to show you here. Because I'm doing cross friction, the elevation isn't that necessary, but when I can do it, why not, right? Okay, I'm going to turn this just a little. There we go. Okay, so 3 fingers. Okay, I'm going to find that tendon, and I am going to super glue my fingers to the tendon, and I'm rolling across it. Okay, my fingers are not sliding on the tissue. I'm literally crossing and coming back. Push across, glide back. Push across, glide back. Not comfortable, is it? I don't know. I'm buying her lunch after this. She doesn't work for free. Okay, so across and back. So your pressure is in one direction. I'm staying in one area for a period of probably 3 to 5 minutes. The reason I'm doing this is I'm trying to jumpstart the inflammatory process. It has stagnated. This has become chronic, right? The body has done a bad job of healing. I'm going to try to irritate it so that it can restart healing. So this would be with your itises, your osises, okay? Sometimes ligaments, if they've healed funny and you got scarring, you get in there because you want them to realign. Once again, we're helping the body, okay? So on the skin, once again, my fingers are not sliding. That's why no lotion. I'm super glued. So everybody, if you have to feel it, take your fingers, super glue them to your skin, and find a structure, and you're rolling across the deep structures. That's, once again, why you need to be aware of where all your anatomical structures are underneath there, okay? Okay, we can also do that on the patellar tendon of the knee. Okay, same exact thing, okay? Relax here, all right? A lot of times what I like to do with deep friction is I want to put the tendon on a little bit of a stretch if I can. So if the patient's sitting, I would want her hand in flexion for the common extensor tendon, right? So we want it in flexion, get a little bit of length. So here she's on over a pillow. If she could tolerate it, I might actually even bring her up here over a bolster. I'm going to come on 3 fingers, and this would be for patellar tendonitis, and I'm going across the tendon. Now this is a real tender area as well, so, but I'm gliding across. My fingers are super glued to the skin, coming across and back, across and back, across and back, across and back, okay? I could do it also lateral ankle, right? Posterior tib, find that posterior tib tendon in the back there, fingers across and back, across and back. I'll put her in a little eversion to pop that tendon out a little bit, but it's right behind the lateral malleolus there, okay? And, all right, sorry, perineals, yeah. Posterior tib would be on the medial side, right? Okay, so let me stop my video really quick, and then I'll start it again. We're gonna do static contact, okay? This will be the last one.